Hi, everybody. This is Dr. Patel. I'm an anesthesiologist and an interventional pain specialist, and I'm here to give everybody a insight into our new product, which the cat's out of the bag now. It is Optimend, and it is Tetrahydrocurcumin. So I'm going to try to give you guys insight into Tetrahydrocurcumin and how it affects inflammation and pain. Just to give you a brief history of my education, I did my internship in Pittsburgh. I did my residency at Vanderbilt University Medical Center in Nashville, Tennessee, and I finished my training at Columbia, and I stayed on staff as an assistant professor in the Department of Anesthesiology. Inflammation and pain. I don't like definitions for these things, but inflammation is the body's response to injury to tissue. And generally the inflammation leads to the pain signal being sent to the brain that something's wrong. Pain is defined as physical suffering or discomfort caused by an illness or injury. And when inflammation leads to chronic inflammation, it can eventually lead to long-term diseases and disorders such as cancer, rheumatoid arthritis, or complex regional pain syndromes, which used to be called reflex sympathetic dystrophy. So as you can see, pain and inflammation are intertwined. As a pain management specialist, I can tell you that even for regular doctors, pain is the most common complaint seen in an office. And it usually means that something's wrong and your body is telling you that. And therefore people tend to go see a doctor when they have some sort of pain, whether it's in their leg or arm, or back or neck. And the one thing with pain is it generally causes other issues in people's lives. For instance, when you're in pain, you tend to be angrier, more anxious, there's fear. Also, pain leads to the most missed work days of anything else. And overall, people's quality of life is also reduced in these instances. What I see in the office most commonly is musculoskeletal pain, usually from trauma or overuse, people complaining of elbow pain from tendonitis, all the way up to muscular pain from what they did over the weekend, or lower back, neck pain, strains and sprains. Also disc disease. I see people with motor vehicle accidents who end up having a disc herniation in the neck or the lower back, and I have to treat that. But you got to define pain in two different types. There's acute pain and there's chronic pain. Acute pain is sort of sudden onset, where you either touch something hot and you burn your hand and you get pain. That's acute pain. Sprained ankles, that's acute pain. Chronic pain is defined as at least 3 to 6 months of duration before you can call it chronic. Some of the more common drugs known, there's so many more, but I'm just listing some of the common ones that people use for pain these days. Non-steroidal anti-inflammatory medications. Obviously, aspirin used to be the most common, but I think today more people are using ibuprofen, which is Motrin or Advil. Naproxen, which is Naprosyn, a brand name is Aleve. Then you have meloxicam, which seems to be very popular these days with orthopedic surgeons trying to treat osteoarthritis. Then you have acetaminophen, which is Tylenol. And then you have a prescription anti-inflammatory, which is Celebrex, which is called a COX-2 inhibitor, and is supposed to have less side effects for your stomach than all the others listed above. Although Tylenol has no GI effects, it does affect your liver, and there are instances where there's complete liver shutdown from a very small amount of Tylenol. So there's a lot of side effects with these medications. And for people who are on non-steroidals for a very long time, it becomes a big problem. Opioids, a lot in the news these days, and I'm sure everybody's hearing about the addiction potential and the problems it can cause. Morphine, which is the most common, oxycodone, Percocets, which is the most common oral medication that most doctors prescribe, hydrocodone, which is Vicodin, which is also used quite frequently, and fentanyl, which I believe should only be used for people with cancer pain, has less of the side effects of the other medications and is more potent, and it usually comes in patches. Then you have the steroids, which prednisone and Medrol dose pack, and I'm sure people who've taken it, especially women, the first complaint I get is, "Doc, it's making me gain weight." And it's a glucocorticoid steroid, so therefore it does affect your metabolism of sugar and tends to make you hungrier, and that's why people gain weight. Also, there's water retention, and a lot of women of pregnancy age also have menstrual side effects from steroids. So, turmeric, it's a flowering plant of the ginger family, and for people who are like Indian food, I'm sure the curries that they order have that orangish color. It usually comes from turmeric. The scientific name is Curcuma longa, and it's principally used in cooking, and also it's used to impart color in certain foods. So turmeric has been used in Ayurvedic medicine since the Indus Valley civilization. And I don't know, I'm sure a lot of people are familiar with Ayurvedic medicine, and it's a Sanskrit term, and the term is broken down as Ayur, which is life, and Veda, which is knowledge. And apparently in Hinduism, it's believed that the gods gave it to the sages, and the sages gave it to everybody else, and that's how the knowledge was passed on. And turmeric is very prominent in the Ayurvedic medicine, specifically as an anti-inflammatory, antibacterial, and enhancer of digestion. And just some anecdotes from my life growing up in a Hindu family. My mother, when I sprained my ankle a few times playing soccer, she used to make a paste of the turmeric powder and salt and heat it up and put it on. And to my surprise, my swelling did go down and I did feel better. And that's just my growing up, what I came across. And also for sore throats, she would give us some turmeric and mix it with water and try to help soothe our throats. So curcumin is the principal curcuminoid that comes out of turmeric. Its major drawback is its bioavailability, which means how much of it gets absorbed in the system. One of the problems is it needs a molecule called piperin, which is found in black pepper. The other problem with curcumin is that it's not very stable, and therefore, by the time it gets into your system, there's very little of it going in. So tetrahydrocurcumin is a product of bacterial or intestinal metabolism by a reductase, which is an enzyme, and it takes the curcumin and reduces it to tetrahydrocurcumin, and it is much more bioavailable and stable. So the benefits of this product, Optimend, which is tetrahydrocurcumin. Number one, antioxidant. Now, everybody's probably aware of vitamin C and vitamin E as potent antioxidants. What that means is that when we eat certain foods, our body's metabolizing it, and free radicals are produced when you smoke, when you do certain things, drinking. Free radicals are produced, and those free radicals, if they're left to their own device, can cause diseases, specifically cancers, because they can affect cells and cause them to go haywire, which is basically what cancer is your own cells going crazy and becoming cancerous. So it's an important in that sense as an antioxidant. It definitely has anti-inflammatory properties, which would help you in everything. As far as just an anecdote from my life. I'm an avid golfer, and I used to take a lot of Advil before rounds or even after rounds. And I've been on Optimend for about 2 to 3 months now. And I have reduced my level of ibuprofen to the point where I don't even think about taking it anymore. I've rarely taken it. The anti-inflammatory effects, there's specific evidence with osteoarthritis and rheumatoid arthritis, where there has been decreased inflammation and therefore decreased pain. There's a lot of studies going on right now. Prior studies were studying curcumin, and because of its low bioavailability, their studies weren't good, but the latter studies that are coming out now with tetrahydrocurcumin are more positive, and there is a good anti-inflammatory component to it. Antibacterial properties, again, it may not be, if you get an infection, I wouldn't just recommend taking just this. I would probably go see your doctor and get an antibiotic as well. But there has been antibacterial properties associated with the curcumin as well. And a significant benefit of this product is digestive as well, which is how the people in the Indus Valley civilization using it in cooking, and it sort of helped with their digestion. The benefits are most dramatically seen in people with irritable bowel syndrome, inflammatory bowel disease such as Crohn's disease and ulcerative colitis. Ulcerative colitis obviously can go on to become cancerous and generally does. Crohn's disease does not go on to develop cancer. But there are several studies these days looking at colon cancer prevention due to its anti-inflammatory properties in the gut. And I honestly believe very highly in Optimend, and I've been taking it twice a day for 3 months, and I have not missed a dose yet, and I feel great, and I look forward to meeting everybody in June. Thank you very much.